So if you've been wondering why somebody chooses to have a facelift, if you're on the outside looking in, the answer is going to surprise you because it's a lot different than what you probably assume are the motivations behind it. If you are, however, a patient who is considering this for yourself, the answer will completely validate why you chose to do it and why you feel like you want to do it, because you'll realize that you are not alone. I shot a little video about this. I posted it on my Instagram, got a beautiful conversation and discussion going with my community on Instagram. So I thought I'd bring it over to YouTube and share it here and get the same conversation and get the same discussion going. And for those of you who don't know me, I'm Dr. Karam. I'm a board-certified facial plastic surgeon. I'm also the founder and creator of Karam MD Skin. So without further ado, let's watch the video. All right, so we're going to address a very common misconception, and that is why people choose to have a facelift, vertical restore, etc. It's not what you think. In literally 20 years of practice and seeing tons and tons of patients, literally thousands, consultations, etc., there's a common theme. And those of you who are considering this is going to totally relate. And to those who need to hear this, husbands, wives, family members, children, etc., it'll become somewhat eye-opening, a paradigm shift. But people don't get facelifts because they are doing it for other people. They're not doing it to impress their husbands and, show off in front of their friends for personal vanity reasons. The reason why people do it, and this is almost universal, is because they no longer feel like they look like themselves, and they want to close that gap between the way they look and the way they feel. And that's a huge, huge point. And as long as you can do it, and as you all know with my vertical restore technique and all the before and afters that you see, you can do this without violating the appearance and making you look like a different person or making you look like you've had a facelift, then the people on the outside don't need to stress about it, because actually their concern for you is mostly related to the fact that, like, for example, a husband really doesn't want their wife to come back after a facelift and look like they're a stretched or pulled alien, right? I mean, and who can blame them for that? I mean, you see these outcomes all the time. People look so different and weird, celebrities, etc. And they just don't want that to happen to their wife. They love you for who you are, the way you look, etc. And they don't mind the aging, but they do mind you coming back looking weird. I always joke with the husbands who come in for consultation that I have 100% husband satisfaction guarantee. And that is because I hand them their wife in their youthful form, not a wife that looks like a different person or it looks like they've had surgery done. So that puts their heart and mind at ease. But for those of you who are trying to understand this, recognize that people do this specifically, totally for themselves, as a gift to themselves, as an opportunity to feel better about themselves, more hopeful about the way the future is changing them, knowing that they're getting a handle on the aging process and really controlling it, as opposed to it controlling, the fate of your appearance and further pulling you away from the way you feel. So that's why this concept of looking as young as you feel is extremely, extremely important and relevant and totally accurate for the motivations and reasons behind people having a decision to go forward with a facelift.
I would say in my early 50s, I hate pictures of myself. I don't like any pictures anymore. Like after a workout, I'll go in the bathroom to wash my hands and I'll look in the mirror and I really can't stand what I see. It's just, I think, not liking myself in pictures, not liking myself when I look in the mirror, all of that.
In the last maybe 5 years, every time I pass a mirror, the jowls are sinking. During the pandemic, when we were doing all of our work, over Zoom, it was just the worst. I would, try to put on makeup. I'd move my computer around, try to get in the best lighting. And I was like, I just need to do something.
I was starting to feel a little bit of the sagginess, and I would get dressed up and I just wasn't feeling perfectly comfortable.
I was at a place in my life where I felt young still, but I really just felt like my face was just so tired and it didn't feel like it matched my personality and the rest of how I was feeling as a person. After having the surgery, I feel like it just kind of connected those two sides back together again. I feel like I look how I feel. I think that's probably the most beautiful thing about the surgery.
All right, so now I'm going to read a few comments from the Instagram post, some things that I think will be interesting. So this is from my patient, Michelle, actually. She had a vertical restore. I definitely won. Thanks for the explanation. You were right on. The surgery was for me, and everyone around me currently would agree that I am the original confident person I used to be in my 30s and 40s. Thanks for being such a great surgeon. All right, and this one is another comment from my patient, Deb. This brought tears to my eyes because it's exactly how I felt. It wasn't about trying to look different or impress anyone. It was about honoring how I feel inside. I still feel strong, full of life and vibrant, and I just wanted the outside to reflect that. You gave me that gift, Dr. Karam. I'm so grateful for your understanding, your care, and the way you truly see your patients. This meant more to me than you'll ever know. That's very, very sweet. Okay, so now I'm going to leave a few more of the comments. So take a pause and read them, and then we'll carry on. All right, folks, I hope you enjoyed that. I hope that shed some light on this matter. And honestly, I think it's a conversation that needs to be had. It's a perspective that needs to be more discussed and more accepted so that people don't feel embarrassed by it. They don't feel guilty that they're doing something for vanity purposes or being perceived as superficial, that the reasons behind it are significantly deeper and much more fundamental to our psyche and our psychology and our sense of well-being than many people assume or think. So share this with some friends and family, share this with anyone who needs to hear it, and ultimately, if you haven't already, make sure you subscribe to the channel and leave some comments. I'm going to answer as many of them as I possibly can, and if you enjoyed it, make sure you hit like. Until next time, Dr. Mir Karam.